Hi everyone, I hope you guys are keeping well. In this video, I'm going to share with you series of core exercises for ankylosing spondylitis. If you ever heard about these terms in your MRI report, today I'm going to share with you what is ankylosing spondylitis is, what is the cause of it, what are the signs and symptoms, and how do we manage this condition, and in some cases, how do we diagnose this condition. If you've never been in this channel, my name is Bob, I'm a physical therapist, and the purpose of this channel is to help people like yourself with simple tips and exercise for quicker recovery. Make sure to subscribe my channel for my weekly update, and don't forget to press that like button. Ankylosing spondylitis is a type of arthritis which is cause progressive pain and swelling in the spine and the sacroiliac joint, the joint that connects our spine to the hip bone. Other joints can be affected as well in this condition, which is a systemic disease, which means it may affect other body parts and organs in our body. This condition tends to run in families in some cases. It affects not only the joint but also the joint capsule and the ligaments. The pain and stiffness will progress to fusion of the spine and the sacroiliac joint. Ankylosing spondylitis in clinical practice is also called bamboospine. It is more common in men versus women. Almost men 3 times more than women, and typically the age range for this condition is between 20 years old to 40 years old. The exact cause of ankylosing spondylitis is not clear. Researchers believe that people with certain genes are prone to develop ankylosing spondylitis when they are exposed to a virus, bacteria, or another triggers. Many people with ankylosing spondylitis have a gene called HLA-B27, but most people that have the gene might never develop ankylosing spondylitis. Study believes only 1 in every 20 people who carry these genes develop ankylosing spondylitis. The signs and symptoms of ankylosing spondylitis are back pain and stiffness, and specifically at night during the rest. This pain and stiffness improves with movement and exercise. Uveitis or eye infection is another sign of ankylosing spondylitis. Hip pain due to the SI joint involvement, shortness of breath, which is in severe cases fusion of sternocostal joint. X-ray, MRI scan, and blood tests are simple diagnostic tool for this condition. And in X-ray or MRI scan, patients are commonly will see with the bamboospine, and when they do the blood test, they were looking at those specific genes such as HLA-B27. There are some other basically genes that they could be possibly exist in people with ankylosing spondylitis that we mentioned here. For treatment of this condition, physical therapy and rehabilitation exercises are the most common treatment, which is keep the patient staying active and help them to maintain their mobility and minimize their pain. In severe cases, anti-inflammatory tablets like NSAIDs are common for using to improve the pain and inflammation. The first exercise that we're going to start with is going to be Superman. You're going to be prone in lying position. You can put some cushion underneath of your belly if you feel comfortable, and you're going to lift alternate legs and arms and hold in that position for a few seconds. You're going to breathe in and out, and you're going to change and try this exercise in both sides. In this exercise, you're activating both upper and lower core muscle that you can engage gradually. You're going to progress this routine to double arm Superman, and you can gradually try to go to a row Superman movement, which is called in W. This exercise can gently activate your upper back and lower back basically muscle, and you're going to try this exercise for 3 sets of 8 to 10 repetitions. We're going to move on to single leg kickback, which you're going to be in quadruped position, and we are going to try to activate our glute muscle. While you're doing this exercise, you're going to engage basically your core and try this exercise in both sides. You can try 3 sets of 8 to 10 repetition initially and progress it to 12 repetition. The next move that we're going to do in this routine is going to be bear dog, which is a progression of single leg kickback. In this routine, you're going to lift alternate legs and arms at the same time. And while you're doing this movement, you're going to minimize the movement in your lower back. You're going to try this exercise in both sides. And we're going to start with 3 sets of 5 to 8 repetition, and gradually you can progress it to 10 repetition. We're going to move on to side plank, which is a progression of these exercises. And if you find the first 3 exercises difficult, you can practice those and gradually move to side plank. You're going to hold the side plank for 3 basic sets of 8 to 10 basic seconds, and gradually progress it to 15 to 20 seconds. If you find the side plank is difficult, you can try the modification on your knees and hold that for 5 to 10 seconds and gradually progress it to 15 seconds in both sides. The last progression that I'm going to show you in this routine is going to be high plank kickback, which is basically advanced exercise. And I would suggest to gradually progress to this routine after you find the first few exercises feel comfortable, and you're going to try this exercise for 3 sets of 8 to 10 repetition in each side. I hope you guys find this video helpful. If you have any question regarding ankylosing spondylitis or any other condition that you find in your MRI report, leave me comments and I would be happy to help you with some sort of details that you can basically follow some sort of structural plan for your recovery. If you need further assistance, you can always book an online consultation with me that we can go through your condition and design a specific and customized plan for you for your recovery. Make sure to subscribe to my channel for my weekly update, and don't forget to press that like button. With helping me with basically sharing this video with your friends and family, I can spread this information for more people like yourself who need help. Make sure to like and subscribe my channel. Until next week, all the best.